Hi guys, and welcome. Hi Ciara, thank you so much for joining me.
Thank you so much for having me.
Awesome. So I know you guys are excited about today's topic because so many people have commented and asked about the time and the date. So as we kick off, I just want to tell you there will be a recording of this available. It's going to be on the Facebook page, so you're not going to miss out on anything. And I'll repeat that a few times just as you guys come on. We're going to be talking about kinesio tape, which is, I think, a favorite topic for both you and I. I love it as a modality. It is absolutely fantastic. But when it comes to facilitatory or inhibitory applications, I'm not completely convinced. And I think that's a good thing and it's okay. So I really want to challenge you guys today. Like, let's look at the research. Let's think for ourselves. Let's not just accept what we've been told to be true. We are evidence-based practitioners, and sometimes that means we need to ask some questions and potentially test the boundaries a little bit. So I'm looking forward to doing that with you today.
I'm excited
to those of you who are listening, to those of you listening, please ask questions, share your experiences. We're here to have a conversation with you as well. So enjoy and join us. Okay, so Ciara, will you please introduce yourself and your interest in our topic today?
Yes, my name is Ciara Crawford. I am the owner of Sozo Equine. So I teach lots of different modalities, but one of the things that I teach is kinesiology tape. I am an occupational therapist by trade, so I was treating humans before I was treating horses. And so I think that that's something that I bring to the table, is that I'm also continuing my education to maintain my OT license. And so that's what I just told Anne before we logged on, was I took one class that kind of got my wheels turning on the tape thing, on direction really, really mattering. This one class almost convinced me. And then I was spinning my own wheels again, and I was like, actually, I don't know that that's 100% correct. So anyways, my background is that I'm an occupational therapist. I switched over to the horse world. I am a massage therapist and just enjoy all of these really fun modalities that are great for owners to learn how to keep the horse feeling really great. So yeah.
Taping and cupping.
Yeah.
Favorites. Yeah.
Yeah.
All right. So before we really get into this, let's just kind of establish that theory of tape direction. So what is it that is kind of accepted as the truth right now in terms of facilitation and inhibition of the muscle, and how do you apply that?
So the action of a muscle is that a muscle will always shorten towards the origin. So my bicep, this is the origin, the insertion is down on my forearm. The thought is that if we start our tape at the origin and direct the tape to the insertion, the recoil of the tape will go back to the origin. Therefore, the proprioception to the muscle is that it's encouraging the shortening or the contraction of the muscle. So the school of thought in this is that if you apply the tape from origin to insertion, then it will help the muscle contract. If you apply the tape from insertion to origin, your recoil of your tape is going towards the lengthening direction of the muscle. So the thought is that if you apply the tape from insertion to origin, you'll encourage the muscle to relax. That's that school of thought. The other school of thought is that tape's not that powerful mechanically. It's not able to contract the muscle or fully relax the muscle. And so I'll tell you, this is the piece that got me in that human class. And so she says, put your fingers at your knuckle and pull back towards your wrist and try to make a fist. Okay, sure. It's more difficult to make a fist because your skin is tighter.
Mm-hmm.
Put your fingers at your wrist and pull towards your knuckles. Way easier to make a fist, right? So that was very convincing. And then after the class, I got to thinking, okay, but what muscle is here? Nothing, right? So we're really just pulling on skin, fascia, there's some retinaculum there. Versus if I put my finger above my knee and pull up to my thigh, I really don't have much restriction on my knee flexion. Or if I put my fingers really tight on, just below my hip and push down towards my knee, there's really not much restriction on hip extension. And so I think this is great in theory. I think it shows us that tape direction matters sometimes. And I think that it shows us that proprioception matters, because we're always taping a whole horse. We're not just taping a fetlock or a knee or whatever it is. And so proprioception is the most significant thing we're getting from taping. So connecting to their brain and teaching them new ways to receive touch is what we're doing. So sometimes it matters and sometimes it doesn't. That's my overall answer for does direction matter?
Well, well, I think like the way that you explained that honestly was fantastic. And my first thought was like, well, this is why you're such a fantastic teacher, because that makes so much sense, right? And I want to throw this out there because I really do. I'm just human. I'm going to be honest with you guys. I just published an anatomy textbook in canines, and I can never remember which side's the origin and which side is the insertion. Okay, yes. I know where the muscle goes. I know where it's coming from and where it's going to, but which side is the beginning and which side is the end? And sometimes it's not clear for certain muscles in certain areas, and then it's just, and then my brain's like, I can't do this, right? So I just want to put that out there. But if you're saying this is the first area where this directional tape gets me, because if I take an elastic band and then I start it over here and then I pull it to over here and I hook it over there, it's not pulling this finger towards this pin just because I started at the pin and pulled it towards the, like once it's stretched and fixed to both points, it's pulling equally in both directions. And so I don't, like, how do we determine if just this thing where we're taught you start your anchor, you place the tape, and then it's going to pull in the direction of that anchor? That doesn't make sense to me. To me, once you apply it, it's going to be stretching towards the center, depending on how much stretch you've applied on it. It's not going to pull more in one direction or another unless you actually have a fixed anchor, like you applied it to the hoof, and then the hoof isn't going to be able to move, so it is a fixed point. And so that's the first point where I'm like, wait, I don't think this makes logical sense. Right. And a lot of our applications are based on that, right? That the tape is going to pull back towards the point where you started, or the anchor point.
And I think that we're comparing it to a muscle. Like, I mean, we are. Like I said, if we look at our bicep and we have our origin point, typically an origin point of a muscle is huge and very fixed. And then the insertion point is a smaller tendon attachment, and it's very mobile. And so if you look at those two different anchors, they're just different sizes, usually different material. Usually it's muscle compared to tendon. And so when we think that one strip of tape that's made entirely of the same material, entirely of the same thickness is going to recreate that, it just doesn't really. Like I said, I think that there is some pull from your tape that can affect your proprioception, but most of the time, especially when it comes to muscle, if we're talking about muscle contractile applications only, I don't see any significance in tape direction. And I think that it causes analysis paralysis. I think exactly like you said, you will get stumped on trying to remember where it is, especially looking at horse owners. Like, just get some tape on that muscle and it's going to help your horse. It's going to increase circulation. It's going to improve their proprioception. It's going to help them with soreness. And so most of my students are owners, not professionals. And I want to say, just put some tape on there. If it's wrong, we can pull it off or it'll fall off, but just put some tape on your horse because it's that significant. And you mentioned being an evidence-based practitioner, and that's tricky when we don't have much evidence, right? There's not much formal research on this, and there's none that compares origin to insertion or insertion to origin. There's none that I'm aware of. And so we really don't have an evidence-based answer. We can think very logically and we can use the evidence that we do have. But really there's no straight answer in the literature. There's one of the studies that I talk about a lot in my class that I think is neat is they took some professional volleyball players. I think they're professional. I haven't read the actual research in a while. But they took some very high level volleyball players that were already performing well. These were not injured athletes. And they compared 4 skills. It was a long jump, a lateral jump, a high jump, and I think a shuttle run. And they taped half of them and they did a sham tape on the other half of them. And the ones that got tape had significantly improved numbers, significantly improved jumping distances and times on their shuttles, etc. And they were actually also looking at ankle stability. And what's wild is there was no tape on their ankle. There was tape on the anterior tibialis, so the front of their shin, and their glutes. And so they were looking at how when you tie together the whole body, these athletes that were already performing well, they were not injured, improved their numbers on all of these skills by having tape on their muscles. And so it's sort of like tapping the muscle. Like I struggle to fire my glutes. So when I go squat with a trainer, sometimes she taps on my glutes to help my brain make that connection of, oh yeah, I have to fire my glutes. So that's sort of what the tape is doing. And that proprioception is happening regardless of the direction that it's applied on the muscle.
I really love that you brought up that article. I haven't read it, but that sounds very interesting.
Yeah.
There are research articles that look at direction of application and whether it's facilitatory or inhibitory. Yes, in people.
Okay.
And actually,
in people, yeah, most of the research is.
That one there's a fairly recent one in equines where they tape the abdominal muscles.
Yes.
And it's not exactly right.
Yes.
They weren't testing the activation of, they weren't looking at EMGs, for example, of the muscles that they were taping, but they were looking to see if there was any change in the parameters of an accelerometer, if I'm not wrong. And there was. I'm not fully convinced by that study. We need to replicate it, but we have those, and I think that's fantastic. But when I go through all the human research that has looked at it, there is a systematic review, and it's literally called kinesiotape inhibitional facilitation factor FAD. That's what they called it.
Yeah.
There isn't really enough evidence to say that if you're going to tape, your directional tape is either going to facilitate or inhibit. There's some, but it's very weak, very little. And there's much more that says there's no difference. So interesting.
It is. Yeah. And like you said, there's really not much research on horses anyways. So we're pulling this research from humans, which is great to a certain degree because living tissue is living tissue, but it's not ideal. So I don't want to be the one to do the research, but I would love it if there was like a vet program that just took it on and said, we're going to start doing tons of research on tape. That would be awesome.
That would be so amazing. But because also with tape, especially as a modality, we can't really take it from people to animals because of the hair difference.
Right.
And I think that is enough of a significant difference that we're not going to be able to extrapolate completely. We need individual research papers that validate or whatever the opposite of that is, the individual outcome measures. So I think that's
muscle
cool.
Tissue. Yeah, the muscle tissue, there's just so much of it. Like I said, comparing the proprioception of the skin on your hand compared to your thigh, and then to go look at their biceps femoris, it's just massive. And so to think that the tape is going to affect, my bicep the same way it's going to affect their biceps femoris is just, it's not comparable just by the bulk of the tissue. So, yeah.
Yeah, and that's definitely not the only difference. So, yeah, no, I like that. Okay, so if we lean on our clinical experience, which is what we have when we don't have research, what do you take? Like, have you seen a facilitatory or an inhibitory effect from kinesiotape?
I can't say that I've seen it.
Are important.
Say that again. Your microphone was a little cloudy.
Oh, sorry. So is that, like, in your clinical experience, is that direction of tape what has come out as the most important, or are there other things that you feel are more important to focus on, like the amount of stretch that you're using, or the level of contraction or lengthening of the muscle during the application, etc. There's a lot of stuff.
Yeah. So like I said, for owners, I don't want anyone to get stuck in analysis paralysis of any of it, really. Only thing we know for sure is that tape helps. And I know that that's really vague and it makes it really more basic than the modality is. But from an owner's perspective, we know that when you have tape on your horse, it's helping them. And so, like I said, an owner's perspective is that I don't want you, if you're just starting out and you need to help your horse with some pain or some recovery or anything, just taping the muscle is a great place to start. Now, for practitioners, obviously, we need to have a little bit more in our toolbox. And I haven't personally seen the inhibitory effects or the facilitative effects, I just see that horses move better. And like I said, I think that that is the dependence on the proprioception of changing their relationship to their pain cycle. Maybe just being aware that that muscle is there, improving the proprioception, because we're working on a whole horse with a brain and past experiences with this tissue and these injuries. And so whenever we can help them feel more comfortable in that body, they move a little bit better. I don't know that they're moving better because of the contractile or the relaxation of the muscle. I personally also don't fall into the camp that I lengthen muscles when I apply it. I know that that is a school of thought. So if I'm taping my triceps, I put my triceps on full stretch, I apply the tape, and then whenever I relax, then we have the convolutions in the tape. That's another school of thought. And to me, that's sort of the same thing as saying that, you know, we have to apply it one direction. I guess what makes this different is we have the muscle on stretch and the tape on stretch, so that whenever we shorten the muscle and we shorten the tape, we have a lot of convolutions. And those are like the waves in the tape. And so the thought is that we're getting a lot of extra lift whenever we do that. I can buy into that a little bit more than I can the direction of the tape, but I still feel like it's not completely necessary. I, again, would love to see a study where we measure actual blood flow and see, even in cupping, like for the most significant change in blood flow to happen in cupping, the cups need to be in place for 10 minutes. And it needs to be a lot of suction to see a true change in blood flow. I don't think we can create enough lift with tape because it's a lot of suction with cups to get that effect. I don't think we can create enough with tape for it to matter that the muscle needs to be on full stretch and the tape applied to get those convolutions to increase circulation that much. With that said, I will always be my own devil's advocate. A lot of times we're overstretching our tape when we're putting it on our horses. Most new people, especially, I think they want it to feel like vet wrap, like they want to feel the resistance in their hands. And so stretching the muscle all the way out and then putting your tape on is helping you not to overstretch. Then do that, because the bigger the muscle plus the more stretch. So if we're pairing too much stretch on a large muscle on a horse, the tape's going to fall off. And obviously the tape on the ground isn't doing anything for them. So if that is something that helps you decrease your stretch, helps you kind of manage the correct stretch amount, then you could do that if you find that helpful. Another thing is on the neck. And so because horses have such a mobile neck, sometimes we can put the tape down the side of the neck and think we didn't overstretch it. But whenever they turn around to get a fly off their flank, that tape can pop off. Or it can just be really annoying because it can pull on their skin because it stretches so much. So the neck is one that I always try to turn their head opposite direction, apply the tape, and come back. Like I said, that's not necessarily because I think it's doing anything magical to the muscle. It's more just practical because I know that that horse is going to move their neck a lot, and I want that tape to be able to handle all of that range of motion and stretch through everything that they need to do, because I want it to stay on them, because when it's on them, it's working.
I think that's really interesting. Guys that are listening to us, please join the conversation. We'd love to hear from you. We're definitely not saying, you know, one thing is right and one thing is wrong. As Ciara just said, I will be my own devil's advocate on most of these things as well, right? So I think it's very interesting. When it comes to that lengthening the muscle and then applying the tape, I actually had it as if you need to lengthen and then apply with zero stretch. If you're really doing that, so you're not stretching the muscle and then stretching the tape. And it's so impractical. It's so hard to actually do that. It's something that I almost never use. You need, I mean, where are you going to do that, right? On the hamstrings, and then you need at least two sets of hands. Someone needs to hold the horse, someone needs to hold the leg, someone needs to apply the tape. It just becomes difficult to actually achieve, and then that's tricky. And I think then I agree with you on the neck. I will always try and just have a little bit of flexion in the opposite direction, just to aid the normal range of motion of the neck and not restrict it. So I love that. And the other area where I would use convolutions is in lymphatic drainage applications. But then it's not putting the entire length of the limb or whatever on stretch. it's really short spaces of application where you're stretching the fascia and then applying the tape with no stretch. And so that feels very different from like a whole full length hamstrings application, for example. So I think that's very interesting.
And the tape made for the lymphatic with the little holes in it, that creates even more powerful convolutions because those holes are there. I mean, that's what they're created to do. So yeah.
Yeah, I love that one. I haven't actually used it's the Hesterband, the Hesterband lymphatic tape. I haven't had the opportunity to use it, but I think it's genius.
I love it. Yeah.
How much easier does that make life? Just so much easier.
I have a horse at home that has kissing spine, and I've used it on his spine so that I can still do his red light and his laser through it. That's not what it was designed for, but there's some other things because to go through the tape. Anyways, I love that tape.
I love that. And what was the other thing that I saw the other day that was genius? Vicken made a little cutter. Did you see that on Facebook? They made like a little cutting tool that you put your tape through, and then you can select you want 3 strips or 2 strips or whatever, and then you just slide the tape through the cutter and it cuts it for you. And I was just like, that is very useful.
That is amazing. I will have to go check that out.
Yeah, a new Vicken invention. Okay, Jessie, thank you for your comment. So about tape recoil when taping ligaments and tendons, how soon does the recoil start to happen during movement, and how often would you tape for ligament support? Recoil help. Do you have thoughts on that?
So I don't know the answer to how soon does the recoil start to happen. I mean, I would say immediately, right? Like you put your tape on, the tape recoils back immediately. How often would you tape for ligament support? Are you asking how often is the tape losing its elasticity? Or are you asking how often should a horse in general be taped? Because if it's a horse that's needing taped all the time, like you're wanting them taped for training and for performance, I like to reapply the tape every 3 to 5 days. I like to give them a day off to kind of let their muscles recover with no tape on and then reapply it. But if you're asking about just in general, like if a horse has a ligament, how often do you tape them? That's just dependent on the case. Like, is it fresh? Is it old news? Is it kind of, what's going on with that horse?
Do you see the comments? Do you have your comments thing open? Oh, no, on your phone.
I can see Jesse's on the screen, but I don't see anything else.
So Jessie replied yes to you when you asked one of your questions, and then just you carried on talking. So I think you were on the right track, but I can't remember where she said that. And then she says when it's losing its elasticity, you're replacing. So that
depends on the brand as well. I am on my own little testing. I don't know. I'm on a kick right now where I'm buying like all of this tape and trying to compare it all. And I feel like still rock tape has the thickest blend of fabric. And so as far as strongest recoil, I think it's gonna be rock tape or Hesterband satin. Hesterband satin, if you've ever worn Spanx, that's what Hesterband satin feels like. I think they're like a luxurious pair of leggings. So anyways, I think those 2 tapes are going to have your strongest elasticity. I think that I would confidently leave them on my horse for 7 days. Whereas if you're buying a cheaper brand off of Amazon or something like that, that elasticity varies. I would say like 3 to 5 days before you take it off. And I would encourage you, Jessie, to kind of experiment because I think the weather affects it too, the humidity and things like that. So put on your horse and then take it off and just kind of feel it and see what kind of elasticity is left in that tape. If you're trying different brands or different days of time, maybe even keep the tape and then write on it, this was on for 3 days or whatever, so that you can sort of feel how that tape was able to withstand the weather and the whatever performance the horse was doing in that tape.
Okay, so experiment. I love that. And Jessie, you say that the tape cutter is awesome. I then assume that you have one, which is so cool. Thank you for sharing that. I saw it a couple of days ago, so I thought it was
I haven't seen it. I'm gonna have to go check it out. That's awesome.
Go check it out. That's gonna make life so much easier. So I like that. And then because we're chatting about differences and things that we do and don't know, if I were to answer that same question, I would say I generally, but it is case dependent, would tape horses on a 7-day cycle so that they have the tape on for a maximum of 5 days, ideally 4 days, and then they have a 3-day break before I reapply. And sometimes that even applies to like tendon support tapes or ligament support tapes, depending on the horse. I might want it on for 2 weeks in the acute phase, where I'm reapplying it as often as I need to, but so that it's on all the time for 2 weeks in the acute phase, and then start tapering so that they have break days. But it is it's case dependent. So that's how I would answer that question. Which is right or wrong? Don't know. All right. So which tape applications right now do you think are supported by the literature? Jessie has brought up tendon or ligament support tapes. You've mentioned proprioception. We've mentioned lymphatic taping. There's so many, right? Myofascial taping, joint support, arthritis, myofascial trigger points. That one is another one that I really love. And if I'm thinking of, a muscle that I want to inhibit, it's usually because there are myofascial trigger points and it's overworking. And then my go-to would be a myofascial trigger point star instead of a directional tape application along the length of the muscle, which is where my mind goes. So what are the ones that for our professionals, Ciara, that you think are supported by the literature and that are your go-tos?
So again, there's not much literature. I think there's the most consistent literature with fatigue, basically. And on my Facebook page, that's the #1 pinned post that I have, is it's 7 articles that show how tape mitigates fatigue. And it talks about delayed onset muscle soreness. It talks about, and now it's human studies, but it talks about humans being able to perform better for longer. And it has, like I said, there's 7 different studies in that one post where it talks about how tape is mitigating fatigue. I feel like that is where we have the most amount of research, is in being able to support the muscles during performance. Now, I do feel like when it comes to the circulation applications or the waves, I feel like clinically I've seen the most significant improvement in those. I don't have the evidence to back that up. And I think, again, I'm really riding this horse into the ground, that goes back to the proprioception. I think that we are changing their perception. We're breaking the pain cycle. We're improving their relationship with that muscle and allowing them to move better. But as far as just watching a horse move, taping them, and then sending them off, those applications really are what I see the most immediate benefits of most consistently. What about you? What do you see that you use the most and like the best?
Pain would be my kind of #1 reason to reach for kinesio tape, and especially in a horse or a dog that doesn't appreciate my manual therapy.
Yes.
Or when I have really chronic pain that I'm struggling to break that cycle, then yes, definitely. Those would be my kind of go-tos. So in my dog patients, I've actually seen some really cool responses with insufficient cruciates or partial cruciate ruptures, or stifles that have progressed, like their arthritis has progressed really far post cruciate, and they're just really struggling. Then I'll tape the stifles, and it's beautiful. It really makes a difference. And then, I mean, just horses, just you could tape them anywhere that it's painful, and it's lovely. So for me, my #1 reason to use tape is to treat an area that's painful.
Absolutely.
Yeah. Yeah. All right. Do you guys have any more questions for us? Any thoughts that you want to share? I would really love to hear from you guys. And then I think we've really covered all the points. I don't know how we do that.
I know. I
right?
feel like we're always so fast. I think this is like my fourth time with you, and I feel like every time it's like 30
How
minutes
did
or
we just
less.
scroll through that? I had like this whole long list of questions. Okay, you know what I do want to actually say? We don't have a lot of literature, but there's always these questions around the literature when it does come out, right? So, for example, that abdominal study that came out, I thought it was really exciting. I was very excited. I was like, this is very cool.
Yeah.
Finally, something that's showing that kinesio tape is effective. But then as I was reading through it, I was like, well, they've used an accelerometer to measure gait parameters, and that's it. They haven't taken any video. They haven't looked at any movement analysis. It's just the accelerometer. And then I was like, well, that isn't actually good enough, right? It's not enough. It's great. It's good. It's the beginning, but it's not enough. And every time we have a conversation around taping studies, there's this question about healthy tissue versus unhealthy tissue. And 90% of the time when we're using it, it's going to be on tissue that is dysfunctional, which is fine. That's correct. But most of the studies being done are on healthy tissue. And so can we, does it apply? Do we see the same results? And it's really good to do the healthy tissue studies because there is the percentage of our applications that we're doing with athletes to facilitate performance and improve performance. So I think that's great. But I think what I would like to just touch on a little bit is if we're reading a research study on taping, what is it that we should be looking for to make sure that it's a good study? Because critically reviewing papers at the best of times is tricky, but there's always topic specific things, right? So like if we're thinking about our question here today was, is tape going to be able to facilitate or inhibit a muscle depending on the direction that you're applying that tape? So if we're looking at studies, the outcome measure is important, right? So how are they actually measuring that? Are they using EMGs in an active muscle contraction? Are they measuring stride length, right? Like what is it that they're measuring? Are they measuring range of motion? Is that that's cool if the range of motion increases, but that's not an outcome measure that's telling us that it's facilitating the muscle. So,
it could just be improving the pain,
It's, exactly. There are other reasons range of motion increases.
Yeah.
So if you think about the studies you've read, what are the things that people should be looking out for when they're reading studies on tape?
I think, like you said, if what they're setting out to determine, if what is being measured is actually answering what they're setting out to determine. And so it's hard too because, well, there's lots of directions I could go with this. I'm trying to wrap my thoughts. Yeah, I think that sometimes the title can say they're looking at one thing and then their actual results show that they weren't. And so something that I've been doing also lately with my own studying is taping hocks and seeing the improvement of the range of motion, specifically in arthritic hocks, old men. I have old men at my house that are already stiff in their hocks and seeing how stiff they are and then taping them and seeing how that's improved. But that doesn't necessarily mean that we've improved the contractility of anything. And so, yeah, I don't know that I'm answering your question well, but are they measuring something that actually answers the question? And are there enough cases for it to be, not that it doesn't matter, are there enough cases for it to be very convincing? Because there's some papers out there where they looked at like 4 horses. It's great information, but 4 horses really is not, solving the world's problems. And again, I know it's very difficult to do all this research. Like I said, I don't want to be the one that does it. So are there plenty of horses? Is it repeatable? Are the outcomes measuring what we set out to measure?
And then I would add, is the study population relevant to the question that they're asking? And then is the study population going to be relevant for you in clinical practice?
Right.
If it's healthy tissue and they're proving a specific thing that's related to dysfunction, then how do you extrapolate that if they're looking at healthy muscles?
Because there's that one paper where I think they tape the brachiocephalicus in a horse. They tape the brachiocephalicus and they're trying to see if it changes their stride length, and it doesn't. And so the conclusion is kind of like, well, tape doesn't work. And I'm like, if it's a healthy horse, so if it changed the stride length, okay, but why did it change the stride length? And like, really, if it's a healthy horse, we wouldn't expect a piece of tape to change their stride length anyways. And so, like I said, you can just go straight to the results section of that paper and they sort of say like, tape doesn't do anything. But when you look at what they used was like, 5 healthy horses, they taped the neck and wanted to see if it was going to improve the propulsion of the front limb. It didn't. And I'm like, well, you wouldn't expect it to, really. So anyways, kind of just think for yourself in general.
Yeah. So some things are obvious. Some things you can read it and you'll be like, wait, that doesn't make sense. That doesn't add up. And some things are less obvious. There was one of the studies that I went through when I tried to figure this whole thing out for myself. They were measuring, they used some tool to measure the stiffness of the muscle, but it was applying an external electrical stimulus to the tissue, right? So the person they had their arm on the table and then it was applying a electrical stimulus, and then they were measuring the response of the muscle before and after taping. And I was like, well, I can't do anything with that information, because what does that tell me? That doesn't tell me anything. It needs to be a contraction from the muscle, from the nervous system, from the individual, and only then can I really do something with that. I think that was my conclusion from that paper, because the tool they used confused me.
Yeah, I've never heard of that one.
Okay, so we have some Julie, thank you for your comment. I find that the studies or reviews are more subjective than objective. Yeah, that can be really frustrating.
And I think that we can all agree, those of us who have used enough tape to see enough horses be happy, I think we can all agree that we know it works. The horse, like I said, the number of horses that I've seen walk up and be very sore and then walk away and be very happy, the huge number of horses. Did I document them very well? No. But anyone who's used it in clinical practice knows it works. As far as being truly evidence-based, we don't even have enough evidence to really be evidence-based, incredibly. So yeah, you're right. It is very subjective. It's like, well, my horse moved better, or they, had less of a head bob or less of a hip drop, or those things are true, but they're not completely being measured in research. Yeah.
So
sorry.
You go for it. No, you go
there
for
is
it.
Someone, I never like to claim people that they're my students, but she has taken my class and she is doing some research right now. I don't know exactly what she's using to measure everything. On her Instagram, she's been sharing pictures of it, so I'm trying to piece it together. But she has these markers on their feet, and I believe she's taping muscles that affect gait, and she's looking at gait differences. I don't want to speak too much to it because I don't want to totally botch what she's doing, but I'm excited to see what she releases whenever that comes out.
That'll be interesting.
Yeah.
So on the subjective measures, I just did a research refresh on Gillian Tabor's paper, which was published last year, where they started looking at creating a composite outcome measures scale for rehabilitation therapists. And I think for this exact reason, developing something like that is so important, because so much of what we do is subjective, but it actually can be measured if we took the time to add a scale to it. A 1 to 5 scale is reliable if we're using it consistently when we're palpating, for example. So there are a few. I'm looking forward to that one because it's in development. There are a lot of areas that we need to create repeatable and reliable outcome measures for. There are some areas in horses that we already have repeatable and reliable outcome measures, but that aren't being used in clinical practice. And if we all applied them, if we all used them, we would be able to compare our clinical results and findings on individual patients and say,
right.
this is how much this patient was able to improve with that intervention, or this is how that patient improved with X intervention. And I think that would be really helpful for us as an industry.
I agree. We all had something that was handy that we, you know, was on a piece of paper or something that we just marked every time we saw that same horse. That's awesome. Yeah, I didn't know that was in the works. There is a tool. I believe they went out of business. Again, I'm talking about something I don't totally know enough information on, but it was a tool that you would put on the tissue. It sort of was like a cup, like actually shaped like a drinking cup. And you put on the tissue and it sort of read the tissue density. And so it would find like a myofascial trigger point and be like, you know, right here, it's very high density and there's a trigger point. And then you could apply the tape and measure that afterwards. The problem is that their app, like, I don't know if they went out of business or what, but their app no longer works and the tool only connects to their app. So maybe there's something like that. Maybe it's being like redone or there's another tool like that, but that's just another piece of equipment that would actually give us measurable information that we could, you know, keep track of things and make it more objective.
That is, I have not seen that one. You need to send that info to me.
Yeah, it's
so
called
I can have
PACT.
PACT.
PACT, PACT. And I believe the tool was called PACT Sense. But like I said, their website and their app is down. And I don't know if they are like rebooting or if something, I don't know. It's, yeah. So anyways, that I have the tool, but you can't, like, it only connects to the app. You can't use the tool without the app. And so it's a weird deal. Anyways, it's called the PACT. Yeah.
Okay. Awesome. Jason has another question for us. So since the equine muscles are much bigger than humans, which size tape would be best to use? Or does it matter as long as the application is properly applied?
I use 4-inch all the time for that reason. I think that you're connecting with more proprioception, more receptors, just more proprioceptions going to the brain. I buy the 4-inch in bulk. Obviously, I'm using 2-inch on lower legs and things like that. But yeah, I use tons of 4-inch.
I love that. I only have the 5 centimeter tape because it's the only one I can get at an affordable rate. So it's all I ever use.
Yeah. You can lay it 2 pieces side by side.
I mean, I don't ever feel like I'm not getting an effective, you know, I'm not getting enough coverage.
Yeah.
But I potentially feel that way because I've always used the 5 centimeter and I've never really worked with the wider one. So I love that. All right, guys, thank you so much for joining us. JC says yes on the 4-inch. I think it's good. So thank you so much for your time today. It's been really great chatting with you. This has been, as always, really interesting. Thank you.
Thank you so much for having me. Like I said, I think this is my fourth time to talk with you, and I love it every time. So
I love it every time as well. Yeah. Thank you. All right. Oh, wait, no, wait. I forgot. Okay. Where can people learn more from you?
So I have my Facebook, Sozo Equine LLC is my Facebook page. On Instagram, I am Sozo Equine _. Both of those are, I'm not posting as much lately because I have a newborn. But I'm usually posting teaching videos or informational content on there. I have a classroom. You can find the link on Instagram or Facebook, but I teach taping classes, cupping and blading classes. My newest class is my peripheral nerve class, so teaching nerve glides and etc. We need to book a time to talk about that too. I know you asked me to and I didn't get on there and book it, but so yeah, we need to get that scheduled. But anyways, so I have all of that content available in online class format, or I have all of those posted on Facebook and Instagram on Sozo Equine. So yeah.
Perfect. Can you tell us just a little bit more about your newest peripheral nerve course?
Yeah, so we talk about the anatomy of the peripheral nerves, what they innervate, are they motor, are they sensory, things like that, how to assess them, and then how to treat them. And so we go through the whole plexus. We start at the cervical plexus, we do all of those nerves, we do the brachial plexus, we cover all of those nerves, the lumbar plexus, cover all of those nerves, sacral. So that's kind of how the class is formatted. People kind of recognize the term nerve glide, so I always throw that in there to help people understand, but obviously If a nerve is very proximal, you can't glide it. So the more distal nerves in the limbs, we learn how to glide them, how to assess them, and how to treat them. Things to look for, kind of telltale signs that tell you maybe their ansa cervicalis nerve isn't very happy, and how to check the hyoid and things like that. And so it's been great for a lot of people. It's actually the class I'm the most proudest of. I don't know if proudest is a word, but I just love it. I think it's great, but it's actually not one of my biggest classes, which is just funny. But the people that are in there are connecting a lot of dots with it of, you know, I see the horse presenting this way, and I was treating the muscle tissue, not thinking to treat the nerve. And so whenever we have the nerve really, really happy that's going to all of the tissues, then the tissues will be happy. So it's almost like it's filled in some missing pieces for some people, and I think that's amazing. So
I think I'm not in any of your courses, so I can't say, but that is the one that I've been the most interested in.
Yeah.
I think it's a really good one to cover. So good job.
It's
We have one last question and then we can say goodbye. So is the 2-inch tape side by side, does it replace the 4-inch? Can you do that?
Yeah,
do you do that?
I
right
have.
Next to your
If I really want to use 4-inch and I don't have it on hand, I will do that. Like I said, you're just connecting to that many different pain receptors. So
you overlap them slightly?
I don't. I tried to butt them up side by side. So obviously when that hair moves, there's going to be some separation there. I don't really worry about, the actual tape being that wide. Like I said, I just want to communicate with that many different pain receptors whenever I'm using that width.
Okay. So just to add that different perspective, I've never actually done it side by side like that to cover a broader area. I will usually have a space between, so I'll try and have more of a like surrounding the muscle feel.
Yeah.
If I don't feel like it's getting enough area just to go through the middle of the muscle, then I'll do like on the back or in the glutes, I'll do like one at the top and one at the bottom.
Yeah. And then sort of frame in the muscle.
Exactly. Yeah.
Absolutely.
Okay, guys, thank you. I hope you all have a wonderful day. If you are watching this as a recording and you have any questions, please share them and we can come back and answer them at a later date. And we're going to schedule in that nerve discussion because we definitely need to do that. All right.
Let's do it.
Bye, guys.
Thank you so much. Bye, guys.